heart failure is towards the back. The one I told you we were going to first. Common sense. Heart. Okay, baby. Now, you see this funky looking lady. That's Big Mama with right-sided heart failure. Think about what I said, because it's going to be the bomb. Blood moves from right to left. My God, is that important? We move from right to left with our blood. The patient with right-sided heart failure had some kind of lung disease. Where was the blood supposed to go after the right side? The lungs. But if your lungs are diseased, where would the blood go back to? The right side. It really is as simple as knowing the direction of blood moves from right to left. Because if your lungs are diseased, they can't receive the volume of blood from that side of the heart. Agreed? So now we done went over here and backed up into the right side of the heart. Well, if you back up blood in the right side of the heart, eventually we all agree that the right side of the heart can't handle it after a while. That side of the heart can't stretch as much as it used to because it's tired of you. It's being overworked and underpaid. All right? Okay, so now if this side of the heart doesn't work as well, doesn't stretch as well, it becomes a little enlarged. We call that cardiomegaly, right? Okay, then it doesn't want to work for us. And it's going to back up blood behind where the heart was. Where was all this blood? In Big Mama's veins. So if there's a vein in the body for this patient, it's going to be congested. Now let me just help y'all kind of put together some veins in the body, because man, this shit all ties together. So we have a few veins you probably should know about. You don't have to write it down if you don't want to, but I'm just saying, just trace it with me for a minute. The first vein, huge, was the vena cava. Believe it or not, watch my hand, it's attached to a hepatic vein. That hepatic vein came off the liver. The liver has another vein going off of it from down below called a portal vein. That portal vein connects the liver and the circulation of the spleen, and it just drains all digestive blood. So in a way, you could say that the liver was a digestive organ. That's why we have it in GI, because its purpose is to drain all of the digestive system's blood. The other veins, kind of irrelevant, but they all matter. You could have veins getting really congested in the rectum. That's called hemorrhoids. They could be in your legs and your feet. That's called varicose veins and edema. They could be in your neck. That's called JVD. They could be on your face. That's called spider veins. They could even be, in the case of the liver patient, on your belly. That's called collateral veins. You care about all them veins, because look what's going to happen. Peripheral edema from the veins in your feet and your legs. JVD from the vein in your neck. Ascites, you will hear me talk about later, is directly responsible from this portal vein hypertension or congestion. You can't have ascites without having portal vein hypertension. It's a vein. Your patient will have enlarged liver and enlarged spleen because they share venous circulation. Everything in here makes sense, even the digestion issue, because you are backing up. What is digestion backed up? It's reflux. It's GERD. If your digestion backs up, you feel full and you don't have an appetite. At the core of the problem was a pulmonary disease. That's why you've got to know that word, cor pulmonale, because at the core of the problem was the pulmonary disease, which was in the lungs and made the right side back up. The right side became enlarged, cardiomegaly, right ventricular hypertrophy. It became enlarged, and then it didn't work, and it backed up all the rest of the blood in every vein in your body. This side is venous all day long. It's so important to remember that. It's venous, venous, venous. I can't say it enough. So R and V. But also this side, just to hook y'all up on Monday, this side is about volume. How much volume of blood is trying to get through this side? Volume is called preload. So we're just going to put preload up here so that it makes more sense. Volume equals preload in your mind. This is the side of the heart that you are kind of thinking has more to do with your preload. Your patient on this side of the heart, if I wanted to monitor them hemodynamically, just so you know, hook up on Monday, I would use central venous pressure. Venous. If I'm measuring that side, I better stick with anything measuring veins. Central venous pressure. This CVP, what does it measure? Volume. V for volume, V for venous. Keep it under preload. It's going to make sense, right? Now, let's do it the other way. Let's say Big Mama didn't have any right side heart failure. She didn't have any lung disease ever. She never had COPD. She wasn't a smoker and had emphysema, bronchitis, none of the things that go under COPD. She didn't have asthma that was only controlled with an inhaler. People that control their asthma with nothing but an inhaler, an albuterol inhaler, they come over here. These patients need steroids or they need a maintenance drug. Sleep apnea patients, those are your really obese patients. Not always, but most of the time, 99% of the time, these are your really big guys, girls too. So she didn't have any of this stuff. None of this, none of this, none of this, no lung disease, nothing, no cystic fibrosis, nothing. She didn't have any of that. Her right side works fine. What does her right side do when it works really fine? It receives, our word, receives the blood, kicks it back into the lungs. Through the lungs it goes with the whole alveoli. Now let's make this side fail, because this is every American. This is every American. This side is where most of your patients are. Although when you go to work at your respective places of nursing and you become this RN in a few days, you will see that this is every patient. But what makes this side so annoying is that it combines in real people, human lives, it combines a little bit of this with it. And you'll find out why in a minute. So let's make this patient our problem. Let's say that the left-sided heart failure patient, they did not have any pre-existing lung disease, and actually what they had was arterial disease. Let's put 3 kind of diseases that they might have had. They probably had hypertension. That would be arterial. Because I don't know if you know, when you take a blood pressure, you put it over that brachial artery. So that type of blood pressure is arterial. Now you can't confuse that with portal vein hypertension, because students do it all the time. You can't go over there over the liver and say, oh, it's high blood pressure. No. It's in the vein. This is in the artery. This patient has arterial hypertension. This patient might have had an MI. That would be arterial coronary artery. This patient may have had an aneurysm. That would be arterial, the aorta. Whatever it was an arterial disease that caused it. So in this case, this patient has definitely got something that has to do with arteries. And what happened with this patient is that the heart got sick and tired of being sick and tired. Now, when this guy gets the blood from the lungs, when the blood leaves the lungs, it's supposed to go over there on that left side. If the left side is tired, it can't stretch, there's no elasticity, there's no compliance, all those funky words you remember, there's none of that crap going on, then it cannot take the blood and get it to leave. L for leave, R for receive. L for leave, lungs leave left. Okay, so the left side gets the blood to move away from the heart, leave the heart, go out to the body. It cannot pump, it can't get the blood to leave. Now, if it can't get the blood to leave, this is not a trick question. If it can't get the blood to leave the left side and go to the body, all the way down to the toes and up to the nose, where is the blood going to back up into? The lungs is what you should have said, because you still got to follow the pattern here. Now, if it backs up into the lungs, this is going to make perfect sense, because everything over here is a lung disease. Everything over here is a reflection of blood backing up into the lungs. If you got blood in your lungs, blood is red or pink. If it's the lungs, there's air bubbles, frothy, pink, frothy sputum. If it's in the lungs, you're coughing. If it's in the lungs, you got crackles. If it's in the lungs, you're short of breath. If it's in the lungs, don't let this crap fool you now. You gotta make sure you tear these words up. Pnea by itself means to breathe. Ortho means musculoskeletal. I need a certain musculoskeletal position to even breathe. As nurses, we document this as 2-pillow, 3-pillow orthopnea. How many pillows do I have to put behind the damn patient to get them to breathe? Because laying back ain't gonna get it. You need to sit them up, right? So orthopnea. Nocturnal dyspnea means at night you can't breathe. Or difficulty breathing. Pnea, to breathe, difficulty breathing. So why would you have more difficulty at night? Because that's when the hell we try to lay down. Syncope goes back to what I was yelling at you about. I asked you what color is the blood, I asked you what's the temperature of the blood, and all of these symptoms reflect the fact that the blood never got to the tissue. When blood doesn't get to the tissue doesn't get oxygen, and when you don't get oxygen, you faint. When you don't get blood or oxygen, you're literally going to have not a great blood pressure on this side, okay? Hypertension caused it, but now that you have it, the blood pressure may be low. Cold, oh yeah, this patient has cold extremities, PVD. They're cold because the blood never made it down there. The pump is broken. Literally on this side, think of it as the pump is broken. The patient's blue or pallor, no color at all. That's pretty bad. That's serious shit right there. And so, of course, because blood is red, you never got down there. Okay, so that just makes perfect sense. All right. Now, S3 heart gallop, I don't know. I've taught med students, nursing students, and whoever else, nurse practitioners, anesthesiologists. This is on every single test I know. It's like almost absurd for it not to show up on yours. The fact that there's an S3 heart gallop is on every single test. So you had to know that this does not go over there. It comes over here. And the way I describe it is I tell you that there's so much blood stuck on this side, you need an extra sound just to get it out, okay? So not two, love dub, no, you got an extra one trying to get this blood out, okay? We're galloping, trying to get the blood out. Now, again, this is arterial. Had to be some hypertension. You could probably throw diabetes in there. You could definitely say something with the aorta wasn't right. You could say maybe this patient had an MI, maybe they had a cabbage, some kind of heart problem ended up over here causing trouble. Even valvular disease, I mean, all kinds of stuff, okay? Pulmonary hypertension, all kinds of crazy, crazy, crazy stuff. Now, let's look at this, both sides. Be careful in your answer. You gotta remember, no matter what shows up on the test, you ought to be able to rationalize which way it goes. This is not an easy question, but it's an important one to teach you. Which one of these sides, right or left, would have pulmonary edema, right or left? Let's look at just the two words. Let's just fart around with the two words. Pulmonary means what? Edema means fluid, inflammation, whatever. So the lungs have filled up with fluid. Are we on the same page? Okay, we got to remember the direction of blood. Blood was supposed to move from right to left. So how in the hell did it get in the lungs? What side? Really? Because right side was the way it was supposed to go. Left side backed up into the lungs. That's the backwards action, isn't it? I wouldn't have pulmonary edema if I had the right direction of flow of blood, because it would go this way. If I did have a backup of the right side, it would back up into the veins, not the lungs. That's why I'm going to keep doing this. You got to go to this test and say, blood moves from right to left. When it doesn't move correctly and the left side fails, it backs up into the lungs, and the right side backs up into the veins all over the body. Now this will make sense. If this side backs up, it backs up into the lungs. That's called pulmonary edema. That's why you had pink, frothy sputum, the hallmark. All right, that's why you had that, because left backs up into the lungs. But guess what? What's going to happen to the lungs after you just keep backing up? It's going to fail. And what's going to happen to the lungs? They're not going to be able to keep doing this, and they're going to cause fluid to back up into what side of the heart? Right side. In other words, beloved, left-sided heart failure can become right, but right side could never become left, ever, because that was the right direction. So when you have a real human being, patients, they look like both these charts. Don't they have all of this plus this? Don't they have like all the lung signs and peripheral edema and a little bit of GERD? And I mean, this whole thing is going to look like one person after they've gone so long with this side failing. It's just going to keep on backing up. Lungs, right side, veins, right? Okay? Now, so you have to remember this will make sense if you just move in the right direction for healthy, move backwards for disease. And man, is that going to make sense when we talk about all this crazy acute stuff on Monday. Okay? All right, now, so if that's true, let's try to make it work for us. Let's look over here a little deeper, because this side I find has got the most information in terms of crazy. It may be because this side is so rare nowadays because we got great asthma drugs. This is the side that your whole life is spent in. Now, we said that this was preload. Y'all agree? Well, this side over here, this is really afterload, because afterload means resistance. Let me explain that.